endometriosis. Let's look at this trial. This is a trial published in 2020. This is about pre-treatment with Dinogest in women of endometriosis undergoing IVF. They had about 151 women, 63 in the study group where Dinogest was given. FSH and AMH were pretty normal. They were all normal responder. And they gave 3 months of Dinogest therapy. Then the lady got menses. Then they gave a washout period of 1 whole menstrual cycle, and then they started the stimulation with a typical antagonist protocol, HCG trigger, and a fresh embryo transfer was done. And what they noticed in the study group, that metaphase 2 oocytes, transferred embryos were same in both the groups, but look at the results. The implantation rate in the Dinogest group was 39%, that in control about 23%. The live birth rate in the Dinogest pre-treated group was 28%, while that in untreated was 14%. The clinical pregnancy was 33% and 18% respectively. So giving a good pre-treatment of Dinogest, giving a nice washout period, and then doing a cycle, IVF cycle could be of great help. Now I am pointing at 2 different studies. These are studies wherein endometrioma was treated, then Dinogest was given and an IVF followed, and both the results were different. In the study by Muller et al. Published in 2017 said that if you give Dinogest after endometrioma excision for 6 months and then you do an IVF, women with no Dinogest therapy had 4.5 times higher cycle cancellations, and clinical pregnancy rate by 2.5 times and live birth rate by 3 times improved if you give Dinogest after endometrioma surgery and prior to IVF treatment. Look at the next study in Tamara et al. Published in 2019. They gave about 12 weeks, about 3 months of Dinogest therapy before starting IVF, and they had less oocytes and less pregnancy rate. But what they did in this particular study, in Tamara study, they induced menses with estrogen and progesterone after Dinogest was stopped, and IVF was immediately started, unlike the Muller study. So in Muller study, the Dinogest was stopped, then they gave a washout period of 1 menstrual cycle, and then an IVF was done. So a certain time period is necessary after Dinogest therapy for the antral follicle counts to recover. So it is better to wait for 1 whole menstrual cycle after Dinogest treatment is given, and then you embark onto IVF, and that could make a difference. So just a small presentation on Dinogest prior to any IVF and in the different studies published with endometrioma.